Hi, welcome to my physiotherapy video site. I'm your host, Brett Wade. The videos contained in this site are for general interest and not meant to replace medical advice or related treatments. Always speak with your family doctor or licensed healthcare practitioner prior to starting any exercise or intervention. Hi, my name is Brett Wade. I'm a physical therapist with nearly 30 years of experience treating patients, and I'm also a college professor teaching anatomy and kinesiology at a local college. In addition, I'm a 500-hour yoga teacher and a meditation guide. One of the most common areas I find myself treating with my patients is chronic spinal problems. And one of the most effective and common solutions to many of these spinal problems, whether they be sports injuries, falls, whiplash, or even childbirth, is teaching people how to properly contract their core muscles. Join me in this video as I discuss what is meant by core, the anatomy of the core muscles, how to build some basic standing poses, how to challenge that pose with some additional exercises as well. Let's get started. So what is meant by this oft-used term core, and where did it come from? It seems that the use of the word core, as it applies to muscles in the center of the body, was first coined in 1982 by bodybuilder Bob Gaida and Dr. Richard Dominguez in their seminal book, Total Body Training. Again, this book was published in 1982. This book was way ahead of its time for descriptions of functional training and core stability and the muscles which were necessary to recruit for functional activity. The authors go on to describe our term for the muscles in the center of the body, core. These muscles stabilize the body when we are in a correct anti-gravity position or are using our arms and legs to throw or kick. They maintain our structure while we do vigorous exercises such as running, jumping, shoveling, and lifting weights overhead. These are the muscles that control the head, the neck, the ribs, the spine, and the pelvis. While much of the focus on core is about central muscles, research has actually also shown that activating or contracting muscles further away from the core, such as distal muscles, leads to a greater activation of the central or core muscles compared with contracting muscles of the core just in isolation. Before we get into looking at the anatomy and looking at which muscles might be considered as part of the core, we should examine why you might be interested in learning more about how to properly contract these muscles in the standing position. Many people initially learn about core muscle engagement for one of really two reasons. Number one, they have spinal pain from an injury like a back injury or whiplash, or their physical therapist has taught them some exercises for these injuries. Or two, they've been taught by a trainer or a coach, or they've learned them in a group fitness class that engaging core muscles to help with sport or athletic performance. In a yoga or a Pilates class, it's very common for the instruction to tell people to contract their core muscles to assist with holding a pose or a position effectively. It is now de rigueur that athletes learn how to engage core in all sports, from horse jumping to golf to hockey to mixed martial arts. Let's now take a look at the anatomy of the most common muscles to be considered part of the core. I will begin with these muscles in the center and then work away from the center or distally. When I show you how to contract these muscles sequentially to build a solid standing core pose, we will actually build it from the ground or from the feet, working our way up. This is by no means an exhaustive list of all the core muscles. The muscles I've selected to talk about here are the most relevant for building the standing pose. So there is more of an emphasis on these muscles, the muscles of the spine and of the lower extremity. In this anatomy overview, I will also describe how these muscles contract, which is their action. I will show you the standing pose for maximum core engagement. It will make more sense once we actually start flowing through it. It's important to note that when you contract these muscles, even a few of these muscles, you are essentially adding tension to the whole fascial system, to all the connective tissue, to all the other muscles. So there's really no such thing as contracting or tightening a muscle in isolation. Contracting muscles in your feet will actually add tension to muscles all the way up in your scalp. Looking at the abdominal muscles first, as they often get the most attention when it comes to core. You can see from this image that the abdominal muscles are made up of 4 thin muscles with the deepest layer called transversus abdominis. Working our way out, then we have internal obliques, external obliques, and lastly, closest to the surface is rectus abdominis. All 4 of these muscles are actually connected by interwoven sheets of connective tissue called fascia. While all 4 of these muscles do slightly different actions when they contract, we will be contracting all 4 of them at once using really the same action. We're going to be pulling our belly button towards our spine actively, not sucking it in, but actively pulling it in. Quadratus lumborum and psoas muscles with iliacus. Quadratus lumborum is a 4-sided muscle, and it attaches to the top of your pelvis towards the back, inserting into the sides of your lumbar vertebrae and up to your last rib. When they contract both sides together, they essentially hold your spine from bending to either side. The psoas muscles with iliacus, collectively known as iliopsoas, also attach to the sides of the lumbar spine and pelvis, but they insert down all the way into the top of your femur. Collectively, when they contract, they can also stabilize the spine. And in addition, they're also known as hip flexors. Erector spinae, as the name suggests, works to keep the spine straight. These muscles, these 3 parallel tracts of muscles, are on either side of your spine, and they run right from your tailbone all the way up towards the back of your head. And when they're contracted, they can help maintain the natural curvatures of your spine. In your low back or lumbar spine, there's an inwards curve, reversing in the thoracic spine, and then back to an inwards curve up in the neck or cervical spine. Looking at the pelvic floor, these muscles actually form a hammock running between your sits bones, your ischial tuberosities, and running forwards towards your pubic bones. When they contract, they actually help maintain continence with bowel and bladder discharge. For both men and women, essentially 2 parts. There's a back part contracting around the bowel sphincter and a front part which contracts around the urinary sphincter or urinary control. Since these muscles form the bottom of the pelvis, learning to contract them helps to stabilize your spine. You contract the anal sphincter by pulling upwards and then holding, and you contract the urinary sphincter in a similar way as if you're stopping yourself from peeing. Longus colli. This segmental muscle spans from the sides of the lower cervical and upper thoracic vertebrae and what runs upwards to insert on the front of the upper cervical vertebrae. When it contracts, it performs a slight nod or flexion of the head. Longus colli is often known as the core of the neck. Serratus anterior and rhomboids. These 2 opposing muscle groups act to position the scapulae or shoulder blade on the thorax. Both muscle groups actually insert into the scapulae. The rhomboids, when they're contracted, will pull or retract back. And serratus anterior, these muscles will actually pull the scapulae forward. If you contract both these muscles at the same time, you actually make sure that the shoulder blades or scapulae are in a neutral position, not too far forward protracted, not too far backwards retracted, but in a neutral position. Hip abductors and adductors. The hip adductor muscles are comprised of several muscles on the inside of your thigh. The opposite muscle group, the hip abductors, are on the outside of your pelvis. Both the adductors and abductors will independently move your leg across your body, which is to say adduction, and away from your body, which is abduction. Just like rhomboids and serratus anterior, when these muscles are co-contracted at the same time, they'll help to stabilize the pelvis and the entire lower extremity, in fact, down past the knee. Quadriceps and hamstrings. These large muscle groups of the leg act in opposition to each other, essentially either extending or straightening your knee, which is quadriceps, or flexing your knee backwards, which is hamstrings. Both of these muscle groups originate up on the pelvis. That's particularly true of hamstrings, originating on your sits bones, or the upper thigh, which is quadriceps. Both of them, though, attach down past the knee or lower leg and insert into the large bone, the tibia. During, again, a co-contraction, both these muscles can hold your knee in a static posture, like a slight bend. They also work together to synchronously help you stand up from a chair, or to squat, or to go downstairs. Dorsiflexors and plantar flexors. These muscles are key muscles to help with your balance in standing. The dorsiflexors are a group of muscles on the front of your shin, which pull your foot up towards you and raise your arch. The plantar flexors are powerful muscle groups, the opposing muscle group to dorsiflexors, and they're at the back of your calf. These muscles help to raise you up onto your toes, but it can also help to, with dorsiflexors, raise the arch of your foot. Now that we've introduced and looked at the anatomy of the core muscles that we're going to be focusing on when building the standing pose, we should talk about how these muscles are to be contracted. You'll have likely noticed that many of the muscles I talked about in the lower extremity especially, or the legs, were muscles contracting opposites or co-contracting, working together. When you hear the word stability, as in core stability, we're really talking about contracting muscles around the joint so they don't actually move, but rather they hold or stabilize. This is called an isometric contraction, and as I just said, also a co-contraction. They are involving a balancing of forces from opposite muscle groups. If you think about holding your elbow in a straight position or a bent position, you're actually doing a co-contraction of muscles of biceps and muscles of triceps. These type of isometric co-contractions are often held for 5 to 6 seconds and then released. Of course, most people can hold an isometric co-contraction or a core stability exercise for much longer, but the quality of that contraction starts to drop as muscle fibers will take turns. Some will rest, some will be active, and this of course is done to allow muscle fibers which have been holding a contraction to replenish their energy stores. That's experienced for you when you find yourself, for example, in a plank pose or a squat and your muscles start shaking. This, of course, is not bad, but for the purposes of teaching how to build an effective standing core pose, I'm going to show these as a sequential contraction building from the ground up, holding while still breathing for about 5 to 6 seconds in each muscle group. Speaking of holding, It's important to note that the breath is never held for any of these poses or positions. Holding a muscle isometrically does not mean you hold your breath. In fact, because co-contractions of muscles can tend to raise your blood pressure, I'm even more aware that when I teach core stability that we have to have the breath flowing. Remember that when you breathe in fully, your abdomen should distend, and as you breathe out, your belly should come naturally back in. I prefer to make an ocean-sounding breath when I do my core challenge exercises. This helps me make sure that I can actually hear the breath and I remember to flow my breath. I breathe in through the nose, filling the belly, and then out through my mouth, making an ocean sound. Now this allows me, instead of counting for 5 to 6 seconds during an isometric contraction, I merely count for 5 full breaths, counting at the movement of the belly. So again, it's in through the nose, and if I do about 5 to 6 of those breaths, we again have about a 5 to 6 second isometric contraction for the core. Once you learn how to do this standing core pose or position, then you can add any challenge you want after it. After showing you how to set up this pose, I'll show you a few examples of some challenges that you can add to the core resistance, such as exercises for the upper body, maybe some balance challenge or some sensory challenges as well. But all of these challenges are designed to make you simply better at being able to stabilize your spine in dynamic situations. Start getting good at building this basic standing pose before adding any of these challenges. The basic standing pose and the challenges can be then adapted to meet specific needs for the individual. For example, if my patient is a hockey player, I will eventually add challenges that are with the person standing on one leg and involving trunk rotation. If my patient is a golfer, I'll focus on trunk rotation with both feet in contact with the ground. If my patient is a construction worker, maybe recovering from low back pain, I'm going to eventually progress them from the basic standing pose that I'm going to teach you, and then I might add step-ups with perhaps weight on a shoulder, or even mimicking swinging a hammer across the body. Once the basic pose is really integrated and understood, really creativity is your only limitation. As always, before beginning any exercise program like this, make sure you've been medically cleared by your family doctor, your physical therapist, or your licensed healthcare practitioner. Let's now begin building the basic standing core pose, and then after that, I'll show you a few challenges. Start with your feet hip distance apart. Have your feet facing forward, or whichever pose is most natural for your feet and your legs. I recommend being in bare feet on a surface that is not slippery, such as a yoga mat. Let's now practice the ocean breathing so that we remember to keep the breath flowing as we build this standing core pose. In through the nose as you fill your belly, and then let the breath out through the mouth as you make the sound of the ocean. Once we set a co-contraction in one part of the body, make sure that you keep it contracted isometrically while we move upwards to the next part. Let's begin. Start by raising the arches of your feet slightly to feel a bit of the weight transfer just slightly to the outside borders of your feet. Now, bend your knees slightly and maintain a co-contraction with quadriceps and hamstrings. Actively bring your knees together using your adductor muscles, but don't let them actually move together, So then apply an opposite contraction with your hip abductors on the outside of your pelvis. Pull up your pelvic floor, starting with the back part of your pelvic floor, pulling it up, and then the front part of your pelvic floor. Now, keeping everything set from the feet all the way up to the pelvis, adjust your pelvis so that it's midway between tipping too far forward and too far backwards. You should have a slight inwards curve in your low back, a reversed curve in your middle back or thoracic spine, and another inwards curve in your neck or cervical spine. Now, actively contract your abdominal muscles by pulling your belly button towards your spine. Remember, this is not the same as sucking your belly in, but actively pulling it in. You should remember that you should be breathing and flowing your breath like the ocean. Extend your arms and have your palms facing forward. Make sure your shoulder blades are balanced between not being too far forward or too far backwards. Actively press them downwards. Keeping your elbows extended, reach your fingers strongly towards the ground. And breathe. Finally, add a slight chin tuck or a head nod, activating longus colli. Let's now flow that ocean breath for 5 full breaths, taking one final check to make sure everything from the arches of your feet to your knees to your pelvic floor to your abdominal muscles being pulled in, shoulder blades, neutral position pressing downwards, arms and fingers extending towards the earth, and a slight head nod is all contracted as you flow 5 full breaths. After 5 breaths, you should now feel that some heat has been generated in your body. This is a very active pose, this standing core pose, for the entire body. Once you've completed your 5th breath, release the pose and shake out your arms and legs. Congratulations, you've just learned the most important basic standing core pose. In yoga, this pose is called Tadasana, or mountain pose. Now we're going to repeat that basic standing core pose just a little bit more quickly this time. And after we do this, we'll enter some of the challenges. Standing, feet hip distance apart, and feet facing forward. Raise your arches. Isometrically, add slight knee flexion, doing an isometric contraction with your adductors and adductors. Pull your knees together, but press them out. Bring up the back and front of the pelvic floor and make sure you're flowing that ocean breath, making the sound of the ocean on the exhale. Adjust your pelvis and your entire spine to a neutral position, respecting the natural curves of your spine. Bring the belly button towards the spine and hold. Extend your arms, turning your palms facing forward, and adjust your shoulder blades so they're in a neutral position. Actively press your shoulder blades or scapulae downwards, extending your elbows, fingers, wrists strongly towards the ground. Finally, add a slight chin tuck, activating longus colli. And let's do 5 full ocean breaths, making the sound of the ocean on the exhale. You can go ahead and release that pose and shake out your arms and legs. I'm now going to show you 3 challenges to add to the basic standing pose. Don't feel you need to add these challenges until you've really mastered the basic standing pose. These challenges, while adding things like exercises or movements to biceps or deltoids or trunk twists, may seem that we're shifting the focus to more traditional strengthening. But make no mistake, this is really all about adding more of a challenge for you holding isometrically the basic standing pose. Once you've set your basic standing core pose, we're going to now do challenge number 1. This is adding free weights for biceps. But again, keep in mind, this is actually not for biceps, but a challenge to the core. You could also use resistance bands, standing on the resistance bands, or as I'm doing here, free weights, using for dumbbells. Again, once in the basic standing pose, we're going to do 5 seconds of contractions, which is really 5 full breaths. As you inhale or bend the elbows, take a breath in, and then as you slowly let the weight down, that's your exhale. Let's flow that for 5 full breaths. For challenge number 2, we're going to be adding trunk rotation using a resistance band or tubing. Once again, you're going to take the basic standing core pose. Notice for the equipment, I have my resistance band tied up high, off to one side of your shoulder. Once the basic standing pose is engaged, reach up and grab the piece of resistance tubing. As you twist down and across your body, you're going to exhale, and as you follow the resistance band back up, this is your inhale. Repeat this for 5 full breaths. Exhaling down and across, inhaling as you come back up. Releasing the band, shake out the body, and release all tension. For challenge number 3, we're going to be standing on one leg and doing deltoid lateral raises using dumbbells. You, of course, again, could use a resistance band standing on the standing leg. on one end of the resistance band. Build the basic pose, and once you've built the basic pose, you're going to be standing just on one leg. You can choose which leg you're going to start on, and of course you would repeat this after your 5 breaths on the other side. Grasping the free weights or the thera tubing, if that's what you're using, standing on your foot, begin to, as you inhale, raise the resistance to 90 degrees, and as you exhale, slowly lower that back down to your side. Repeat this for 5 full breaths, inhaling on the way up and exhaling on the way back down. Once you've completed your 5th repetition, release the weight or resistance band and shake all the tension out of your body. I hope you feel you've learned now a little bit about what core is and how to contract the muscles of the core. Remember that the basic standing pose is useful for anybody who has spinal problems, or for somebody who wants to perhaps improve their performance, or for anybody who is even trying to prevent from having spinal problems, or somebody perhaps interested in even just improving health span. Once you master the basic standing pose, which can be done anywhere, I in fact like to do it even while standing brushing my teeth, you can take this pose with you. You could practice elements of the pose while walking, standing at a desk, pushing a shopping cart. And as far as adding challenges, remember that the sky's the limit. Remember again that the challenge is not really about trying to build bigger muscles in your distal muscle groups like your arms or your legs, but it's a challenge to improve your functional strength in your core, your center. If you've enjoyed this video, please give it a thumbs up and subscribe to my channel. I'm motivated to make videos to help people with all kinds of injuries or challenges and to improve health span. I not only have physiotherapy videos, but meditation videos, documentaries, podcasts, and just general health videos. I wish you well on your journey. Peacefully, Brett.